Hello, everyone. This is Mohamad Bittar, a rheumatologist at the University of Tennessee Health Science Center in Memphis and a member of Young-GRAPPA. I'm very happy to be chatting today with one of our senior GRAPPA experts, Dr. Alexis Ogdie. Dr. Ogdie is an associate professor of medicine and epidemiology at the University of Pennsylvania Perelman School of Medicine. She is also deputy director of the Center for Clinical Epidemiology and Biostatistics and director of the Penn Psoriatic Arthritis and Spondyloarthritis program. Dr. Ogdie's research program focuses on pharmacoepidemiology and observational studies of psoriatic arthritis. The mission of Dr. Ogdie's research program is to improve outcomes in psoriatic arthritis by accelerating diagnosis, increasing the focus on meaningful patient-centered outcomes, and developing and advancing methods for precision medicine. Welcome and thank you, Dr. Ogdie, for joining us today.
Thanks so much for having me.
Thank you. I would like to start by asking about your journey with GRAPPA. When did you join? What was your initial role? How did that evolve with time? I'm pretty sure this will inspire a lot of junior members.
Oh, thank you. Well, I first joined in 2010. I was an instructor, so I just finished my fellowship, and I attended the meeting with Joel Gelfand, who was my mentor at my institution at Penn, and is still one of my mentors. He had encouraged me to submit an abstract for the trainee symposium. So I had submitted an abstract that previous April and then came in July in Miami to present the paper. So that was my first kind of role as just a presenter at the trainee symposium. And there I got to meet all kinds of people in the field. And I was really just getting into it at that time. And literally had just started research in psoriatic disease and still getting to know the disease. So it was a great opportunity to learn more about the disease and then meet lots of people. And I actually met Laura Coates that first meeting. She was presenting there and I was like, wow, she's so awesome. So, and she was just a couple of years ahead of me. So it was exciting at the time to meet someone young and have someone to look up to as well. And then I kept attending the meetings and kind of got to know people better and got onto some of the committees. It was like, helping with treatment recommendations or other pieces that I could have a little role in. And sometimes I was just being part of the group and learning from people. And sometimes I was as an author on a paper, for example, or writing up, the report from the meeting. So that was kind of one of the ways I first got involved. And then as we went on, one of the nice things about being a trainee and kind of coming into that role in the trainee symposium, especially now you have young Grappians, is you get to know each other and then you become each other's support. And so my closest colleagues today are some of the people that I met at GRAPPA in that trainee role. So we were all kind of in the same boat and kind of were able to be peer mentors for each other. So I think I'm really excited for you all to have kind of more formalized organization to be able to have some peer mentoring.
Thank you. Of course, this is very important and very inspirational. And of course, networking is very important between young Grappians and between young GRAPPA and GRAPPA is extremely important, of course.
It is. And actually, that's one of my kind of pieces of advice is for the younger GRAPPA members is kind of make those connections, especially at the meeting in person. It's really helpful to make those connections in person. So you have a face to put with a name, and then establishing just that relationship as mentoring or asking if they have any projects that they need some fellows help on. I think a lot of us have plenty of those opportunities.
Definitely. What do you think about the Young-GRAPPA initiative and its expected contribution to the mother organization GRAPPA?
I think that I'm really excited for the young Grappians to kind of be getting off the ground and having not only that network with each other, but also to support GRAPPA. As people grow up scientifically, we need that base level and we need to keep nourishing the field with lots of new investigators. And so I think it's good for those of us who are kind of at mid-level or more senior level to be seeing these young investigators. I think one of the other great things is sometimes we just need doers. And so, trainees are great doers because you learn through doing. And there's plenty of things that we're all leading that we could really use more help on. And you can be the face of the project and kind of get things off the ground, but also kind of helping support the team as well. So I think we need people at all levels for the organization to thrive.
Definitely. Again, this is an extremely important point because it's a teamwork. And of course, everyone can play a role in this project to advance it and to get to some very good outcomes, of course. And lastly, I would like to ask you if you have any advice to junior GRAPPA members and providers who have a special interest in psoriasis and psoriatic arthritis. Probably there are some providers that are very interested, but they do not know where to start in their journey. So do you have any advice for them?
Yeah, I think, when you're first walking into a big organization like GRAPPA, it can feel like a lot, like you're not quite sure where to start or how to get involved. I think just being at the meetings is more helpful than people might even realize. So just being there, seeing the faces, joining the small groups and talking within the groups with people, those things are really helpful to getting kind of your foot in the doors, so to speak, and just kind of getting to meet people. In addition, I think it's then by forming those relationships over time, you cultivate those relationships and start to really get more involved through, different investigator groups, for example, or clinical groups. I think there's lots of ways to get involved. And I think the other piece is just learning. It's so much fun to learn from each other and, bringing cases that you're struggling with to somebody, or, talking through different clinical aspects of psoriatic disease is really helpful for all of us to learn together.
Definitely, I 100% agree with you, and it's something that we see in every meeting we go to, we attend, or every lecture we attend. We always learn something new from every conversation we have with our colleagues. We learn something new. So this is very important, of course. Thank you so much, Dr. Ogdie, for joining us today. It was great talking to you, and really hope to see you very soon in person.
My pleasure. Thank you so much for the opportunity, and good luck to you all.
Thank you so much.